May is Mental Health Awareness Month, and of course, today, maybe more than any other day this month, something we really need to address. So, joining me from Circle of Hope, we have Edric Hall, Sonia Boyd, and Alan Perkins. Thank you all for joining me.
Thank you.
Tough discussions with our families, with our loved ones, with our children today following what happened yesterday. Sonia, I want to start with you. Talk a little bit about why it's so critical for people to feel like they can come out and say when they think that there could be an issue inside their homes.
So when we were talking earlier, a lot of things that we run into or that we experience with parents, with grandparents, with what we call guardians, is they feel like there's no hope. And I don't want to keep saying that, but that is true. That's what we hear all the time, and hence the name Circle of Hope, because we want to be able to let people know that we are here to provide those services that you need without judgment again. But what needs to happen, or what should happen in most cases, is when you see a change of behavior in your child or in your loved one, I should say, because we service children starting at age 4 all the way up to adults to 99 years old, right? But when you have those feelings of depression, anxiety, feeling overwhelmed, feeling stressed, reach out to a loved one, reach out to someone, call 211, call 911. There are mental health police now available, which I think is wonderful. And you can come to call Houston Circle of Hope, call Beaumont, and get the services that you need. So many different traumas and triggers and transitions happen in our life, especially after COVID, and then yesterday's awful traumatic event is heartbreaking. And if you're feeling emotional about it, if you're feeling fearful about it, please do not hesitate to call someone in the professional mental health arena that you can talk to.
Perfect. All right, Edric, I want you to talk about, you say people, they deal with from the neck down, keeping themselves healthy, but it's from the neck up what you need to address.
Absolutely. One of the things we always say when we talk about mental health is that lots of people spend excessive amounts of time taking care of the physical aspect of the body. But when we think about a body, it starts at the head, the mental part of it as well. So as we work in therapy, or as we work in skills training or case management, we help you to make sure that the mental part of the body is taken care of. Because as we know, if the mind is not healthy, then the rest of the body's not healthy. You can look as good as you want to physically, but if the mental aspect is not taken care of, then there's a huge gap in your physical, in your total being. So with mental health, we help you to recognize the issues that's going on, and we help you to reach the goals that you would like to reach as in becoming mentally stable. And that's why mentally healthy. That's why we call it mental health.
Real quickly, talk about some of the signs, symptoms for parents or for loved ones.
So loved ones, when you start seeing your loved ones isolating, when you start seeing your loved ones eating less or eating more, when you start seeing them being more agitated, irritated, when you start seeing them talking about they have no reason to live anymore, they don't want to live anymore, we call this hopeless or helpless. Those are some of the symptoms that we often see. When you see a loved one who've had a breakup of any sort, it may be a marriage, it may be a job, it may be a traumatic event that you see them struggling with, those are signs that there may be something going on. When they're not talking to you as much, when they're not socializing as much as you normally would see them, when they're not as bubbly as they used to be, or sometimes when you see them over bubbly or over happy, those are signs as well. So you have to be really careful to pay attention to those loved ones and to recognize something is different going on, and then you have to seek help.
And real quickly, Alan, tell us where they can get that help locally.
So locally, you can reach out to me, Alan Perkins. I am with Circle of Hope, and what I do is that I reach with all the community partners and parents in the community. It's a simple website, Houston Circle of Hope. Type that in. You can go to the website, and it has all the information necessary, even my phone number or the other office phone number to ask for help.
And The big takeaway is there is help available. Recognize those signs and symptoms. We want to put an end to tragedies like what we saw yesterday.